open pneumothorax is defined as injury to both the pleuras. So when we talk about injury to both the pleurae, what do we mean by this? You know, there is in tension pneumothorax, I have shown you there is injury to the what pleura, students? Injury to the visceral pleura. But in case of open pneumothorax, you should understand both the means visceral also is damaged and parietal is also damaged. The problem is not the injury to both the pleurae, but the problem is that they're not only they're injured, they're connected to the what atmosphere. So with connection with the surface of the body. So with the connection with the external surface, and this is what is really very important. So injury to the both pleuras with a connection to the external surface, and this leads to equilibration of the, you can say, of the pressure. So when we talk about the equilibration of the pressure on both the sides, what is going to happen? This is going to stop the respiration, and that is why open pneumothorax is considered to be what, students? A life threatening condition. Let us try to understand by drawing a diagram or image. So let us understand this to be the visceral parietal pleura, and let us understand this to be the visceral pleura. So both the pleuras have been what? Injured, and this is in connection with the external surface. So let me draw that also. So this is the diaphragm. To make it more understandable, let me make it more relatable. So I hope now you can understand this. These are the ribs. So now you can understand that both the pleuras have been damaged in connection with the external surface. Now what is the problem? The problem is that the P atmosphere, which is outside, and P lung inside, they are not same. So P atmosphere outside is more than the P lung, and thus the air will go and enter inside the lung, and you will say, sir, it is good, it was destined. But this is not by the normal way, rather via the lung, rather via the injured side of the lung basically. So remember, this is very important. Since the P atmosphere is more than P lung, the air enters into lung via what, students? Via wound, and this is the reason why it is known as what, students? Sucking chest wound. Is this clear? Now understand, this movement of air continues, unless P atmosphere equals to P lung, and the moment this happens, we call it equilibration of the what, students? Pressure. And whenever there is equilibration of the pressure, the respiration is automatically going to stop. Now let us understand a composite management. What is the problem? The problem is the air is entering from the outside, and this has led to what? P atmosphere and P lungs to be what? Normal. So whenever the patient comes to you, what is the emergency management that we need to do? We need to understand that we need to break this connection, and that is why what you people do, most of you try to attempt this. You know that okay, this is connected with the atmosphere, so you put a dressing, and this dressing is having the tape on all the four sides. So by this you disconnect the lung from the atmosphere. So virtually you have sealed the parietal pleura, but what about the visceral pleura? It is still damaged, and this converts the open pneumothorax into what? Into a tension pneumothorax, because still the visceral pleura is unrepaired, and therefore this is not to be done. What is the basic thing that you want? You want a one basic thing, that's an air. This is, imagine the wound, the air from outside should not enter. So what is the basic requirement? Suppose this is a dressing, I put a dressing. So when I put this dressing, the air is not entering inside, but same way the air which is going into the pleural cavity is also not coming out. So what I will do, I'll put a dressing, just follow my fingers with the taping on how many sides? 3 sides. One side is still open. So what will happen? The moment I inspire, the air goes into the what? Lungs. From lungs into the what cavity? Pleural cavity. The pressure is elevated, and this is. So this is what is known as occlusive dressing with taping on how many sides? 3 sides. So this is wrong. Yes, you need to disconnect. So this is the wound. So what you will do, you will put a dressing which is bigger than the size of the wound. So the air from the outside will not be able to enter But since this dressing is taped on how many sides? 3 sides. The extra air can be vented out from this. So the inner pleural air, yes, can always exit. So what is the emergency management? Students, this is defined as dressing with taping on the 3 sides, with taping on 3 sides. This is what is very important. Now imagine a scenario, your eyes will never see what your brain doesn't know, and you said, okay, I have done, I put a dressing, let me discharge the patient. So imagine if the patient walks out of the hospital and this dressing goes off. Now someone is crying, someone is panicking, someone is abusing. So one of our wise relative goes to a medical shop, quickly runs, buys a good quality, you can say leucoplast or maybe a dynaplast. He puts one here, one there, and then where? Gone. The patient is gone. Why? Because you have committed the same mistake which doctor never wanted to. So remember, this is only a jugaad to restart the process of ventilation once this is done. So in exam also, you should know whether emergency management is asked or definite management. So what is the definite management? It is very simple. The definite management is you have to open the thorax. So that is what is known as thoracotomy. So thoracotomy followed by what, students? Followed by repair, and this is what is very important thing. So thoracotomy followed by the surgical repair. This is what is really very important thing in this case.